Hello and welcome back to the next video of Orman. Today we are going to discuss the difference between croup and epiglottis. Let's start with the first topic, which is acute laryngotracheobronchitis, which is called as croup. Acute laryngotracheobronchitis is basically an infection of the subglottis. Our trachea is divided into three parts. First is epiglottis, second one is glottis, and the third one is subglottis. Glottis is basically our vocal cords. Anything above vocal cord is called as epiglottis or supraglottis. Anything below vocal cord is called as subglottis. And here in ALTB, there is an infection to the subglottis, which is below the vocal cords. The most common organism is in parainfluenza virus, so it is caused because of the viruses. The age group is between months to years and seen mostly in the boys. So as you can see in this picture, this is around a 3-4 month-year-old boy who is suffering from croup. What are the clinical features that we can see? First of all, there will be a respiratory difficulty which is mild, and there will be a stridor. Why would be there a stridor? Because it is present below the vocal cords, so there will be a difficulty in breathing. There will be low fever because of the virus, and this is the main hallmark feature, which is called the barking cough, which is present in the croup. Here in this radiological image, as you can see in the anterior posterior view, this is the right side, this is the left side, you can see this beautiful sign called as the steeple sign. While differentiating croup with the acute epiglottis, we are going to check what kind of X-ray we are performing in acute epiglottis, and we'll see the difference. Here remember that the steeple sign is present in the croup. Steeple is basically, if you ask me what is the steeple, steeple is basically a dome-like structure which is present above the church. So this is like a pointed thing that is seen in the X-ray anterior posterior view is called as the steeple sign. This is the same thing. There is a narrowing at the subglottis because there is infection to the subglottis. That's why there will be a narrowing. What is the treatment? This is basically humidized oxygen, O2, bronchodilators, steroids, and antibiotics to prevent secondary infection. So because of the croup, there can be a chance of having secondary infection. To prevent that, we give antibiotics. The next topic is acute epiglottis. Okay, what is acute epiglottis? This is caused because of the bacteria. As we have seen in croup, it was caused because of virus. This one is caused because of the bacteria. What are the two important bacteria that can cause acute epiglottis? The first one is Streptococcus pneumonia, and the second one is H. influenza. So if you get a question in which you have both the options, just choose the first one as Streptococcus pneumonia, and then you can go for H. influenza. If you have just H. influenza, just choose H. influenza. If you have just Streptococcus, choose just Streptococcus. Now the age group here is very specific, which is 2 to 7 years. In croup, what was the age group? It was between months to 3 years. Here it is after 3 years, so like between 2 to 7 years. Remember that acute epiglottitis is an emergency condition. We'll see why is this emergency condition and what are the treatments we need to do for this emergency condition. Emergency condition. So here the patient or the baby will be very sick and it will have a respiratory distress. So there will be a difficulty in breathing, and there will be inspiratory stridors because of supraglottis involvement. Here the supraglottis is involved, and in croup there was subglottis which was involved. Anything above the glottis will have inspiratory stridor. Anything below the glottis and glottis will have expiratory stridor. So as you can see, epiglottis is above the glottis, so it will have inspiratory striders, while croup is present below the glottis, which is subglottisly presentation. That's why it will have an expiratory stridor. There will be fever of 103 to 104, and there will be a drooling of saliva and hot potato voice. Hot potato voice is basically when you eat something hot and then you try to speak while you eat something hot, and you'll have this hazy voice of hot potato voice. It's like, I am having a lot of food. So, this is basically a hot potato voice which is seen in these children. The baby will have respiratory distress. That's why the child will try to increase his breathing. For thus increasing the breathing, the child will sit in a particular position which is called as tripod position. This, you know, the basic tripod where we attach our cameras to. So one, two, and three. These are the three stands of the tripod. So these are the two arms of the baby, and this is one of the body of the baby. So this is called as the tripod position. In the X-ray, you can see this is not the AP view, but this is a lateral view. In the lateral view, you can see this. This is called as thumb sign. This is basically thumb sign of the acute epiglottis. Lateral view will show the thumb sign. What is the treatment? As we have already discussed, this is an emergency condition as there will be a respiratory distress. So, if the respiratory distress is performed, we have to urgently do an intubation to the patient and save the patient to improve his breathing. Also, remember avoid laryngoscopy, which is passing a camera into the larynx again and again because it will increase the edema. You can give steroids and antibiotics to prevent secondary infections. Now, this is the difference between croup and epiglottis. The next topic is laryngomalacia. Why is laryngomalacia important? Because you can see this is epiglottis, but this is not the normal shape of the epiglottis. This is shaped as an omega. Omega, this side. As you can see in the picture, omega shape of the epiglottis is called as laryngomalacia. What can be seen? Stridor, inspiratory stridor, because obviously epiglottis is affected and epiglottis will cause inspiratory stridor. Glottis and subglottis will cause expiratory stridor. Why is this important? Because this appears in the first week of life. So earlier presentation can be seen of laryngomalacia, which will increase on crying, but the cry will be normal. Why is the cry normal? Because the vocal cords are normal. This is a problem with epiglottis, that's why the cry will be normal, but there will be increase in the stridor when there will be crying and decreases in the prone position. So while you sleep in supine position. S for sleep, S for supine. And when you sleep on your stomach, it is called as prone position. So this stridor will decrease when the baby is sleeping on the stomach. What is the treatment? This is basically conservative treatment. If there is no cyanosis or hypoxia, cyanosis is like bluish discoloration of the extremities and hypoxia is low oxygen supply. If there is no cyanosis and no hypoxia, you can just tell the mother, reassure her that everything will be fine and it will resolve on its own. Just help with the conservative management. The last topic is functional or hysterical aphonia. So here you can see this young girl of age between 20 to 30 years. She cannot speak or she is not able to talk. But what is the reason of this girl not able to talk? This is because of the psychological problem that the girl has. Now, how is this functional or hysterical aphonia diagnosed? First of all, you need to ask the patient to cough because the vocal cords are normal here as well. That's why the cough reflex will also be normal. But if you ask the patient to cough, normally the patient won't cough. So you have to use some tricks and minds, like while you're palpating the patient or while you're hearing the breath sounds, you can ask the patient to cough. If you can hear the cough sounds, this is mostly because of a psychological problem, and then you can just help with the psychotherapy and give a psychiatric consultation and the patient is all right. That's it for today. I hope you understood the difference between croup and acute epiglottis and the other two topics. If you have any more suggestions, please let me know in the comment section. Thank you.